In many parts of Oklahoma, it's a long drive to the doctor or hospital. In many of these rural and underserved communities, nurse practitioners are the front line of primary health care. Nurse practitioners are registered nurses with advanced training and education. They offer affordable, accessible, and high-quality care to their patients.
The person at home, they hear RN. They may get confused. They say, well, I'm just seeing the nurse? You know, what's going on with that? I'm your primary care provider, just like the MD or the DO. Nurse practitioners are here to be your primary care. We're going to address everything.
We're trained through graduate training and through clinicals and years of experience to handle diabetes, heart disease, obesity, depression. We handle them not only with counseling and medication therapy.
Nurse practitioners are usually in a lot of rural areas. People that only have the nearest healthcare provider is 45 minutes away.
As nurse practitioners, we can specialize in family practice, in adult care, in pediatrics, in mental health, and in women's health.
I thought, why do I need a family doctor when I can go right over here? And I've been very pleased.
Coming out and visiting with the nurse practitioners, I really like the level of care that you get. I don't really feel that there's a whole lot of difference between, the care I get at the physician's office versus the nurse practitioner.
Other doctors don't always know your name, so I've always felt very comfortable here.
With Oklahoma beleaguered by poor health issues, nurse practitioners are a great resource for getting the state on a healthier track. But Oklahoma law is in the way. Law does not allow nurse practitioners to operate independently. Instead, they must be supervised by a licensed physician. Plus, a federal law passed in 2014 prevents nurse practitioners from prescribing certain drugs that they previously had been allowed to prescribe.
Well, as a nurse practitioner, what I can't do is I can't prescribe Ritalin, some of the antipsychotics that you may need for some of your ADHD children. This does limit our practice because we do see a lot of kids that funnel through and they have some ADHD, and our system's so bogged down right now with psych issues that it may be 6 months, it may be a year before that patient's even seen with a specialist. As of last year, now we can't prescribe hydrocodone, which we've had for decades.
Nurse practitioners are pushing for changes to state law so they can independently provide much-needed, affordable health care to Oklahomans. It's what our state's greatest resource, its people, deserve.
Having the restriction lifted from us for having collaborative authority with physicians to watch over our practice, in a sense, would allow more practitioners to go into independent practice and open their doors to where they can see the patients, and patients have easy access into their primary care's office.
If we're allowed to practice more freely and lift those barriers and those restrictions, you're going to have multiple people be able to see a healthcare provider more readily, more quickly, and someone that's going to treat them and follow them. Because it's about the patients at the end of the day. Oklahoma has to get on board with what other states around us are doing.